Following segment is sponsored by Oakview Medical Associates.
A little bit of self-care can help us look and feel our best. And for a lot of people, Botox treatments are becoming a regular part of their maintenance. Dr. Nita Bajur is here from Oakview Medical Associates to talk about it. Good morning, Dr. Nita.
Good morning. How are you?
Good. You know, people are really comfortable talking about their Botox appointments now, even proud that they're taking care of themselves. What's the perception of Botox today?
Yeah, Botox is so widely accepted now. It's become mainstream, and it's probably the #1 procedure in the world. So it's very easy to perform. Wow. It's short-lived, self-limiting, so people love it.
Yeah, a lot of people love it. And you have actually brought with us a patient who's here today, willing to be part of this demonstration. And you're just going to show us kind of how this is done. So if you want to take it away and walk through it.
Okay, and I have already cleansed her face, and I have some ice packs ready. Basically, the procedure involves small amounts of a medication called botulinum, which we take in a syringe, and we've already reconstituted it. What it does is it basically, we put these tiny injections right under the skin, and it relaxes the muscles, so softens the muscles, and wherever the patient has lines, it just gives them a very soft effect. So I'm going to ask her to demonstrate some of her lines. Raise your eyebrows for me. So you see those fine lines there, and that's what will reduce and possibly go away in her because she's young and healthy with these injections. Make the angry face for us. Okay, so those lines are called the number 11s, and they go away. Also smile. She has slight crow's feet, not too bad, but those will also soften. So I'm going to demonstrate. It lasts about 8 to 12 weeks, and usually you can have it the same day. You can go out. You can. It doesn't take any big preparation.
Yeah.
I'm going to show you a little bit. We're right under the skin like that.
Excellent. And as you're doing that, that's going in. You know, people know this process. It's not necessarily new, but what's happening medically as this is taking place?
So as you can see, I'm injecting right under the skin, right, making tiny little blebs there, and that is going to go ahead and soften the frontalis muscle, which is the forehead muscle. And it takes about a week to 10 days to kick in, so it's not instant. Common side effects could be bleeding, swelling, which is normal. It's not a complication, and it's kind of expected because the face has a lot of blood vessels. But it's really well tolerated. Are you in any pain, Steph?
No.
So it's very well tolerated.
Very well tolerated. And you said 8 to 10 weeks is
Yeah, 8 to 10 weeks. So if you have a special event coming up, we plan it out for the patient. We make sure we do it in time to get, ready for that special event. So.
And it's important to have, I mean, it's good for a doctor to administer this. You are, you're great in your trade at this, and people can trust this process with you.
Right. See? So it's pretty simple to perform. Make sure you get it done by a licensed physician or provider. And, ice packs after the procedure, that's all it takes. It's just a little bit of soothing the area, and she's good to go.
Yeah.
It also has medical indications, Margaret, so it's not just cosmetic. It's used for migraines. It's used for other things, too. So it's a very, it's been around a long time. So.
Yeah, but it's interesting. People use it for many different reasons, and I had no idea that it was the most common procedure in the world, or it might be. So anything else you want people to understand about this process before we go?
I think we need ice. I think, it all has to do with lifestyle and wellness. If you lead a good, healthy lifestyle, eat well, then taking care of your skin is just an extension of that. It is very empowering. It makes you feel more confident. Yep. And, sometimes it's not just the older people that get lines early. We have younger people that just have forehead lines and we soften that. That just is a boost of confidence for them. So they have a wonderful experience.
And the sooner they soften it, the more effective it can be. So certainly a lot of interest in this. We appreciate the information and that demonstration at Oakview Medical Associates. You want people to look and feel their best. Anything about your practice before we head out?
Yeah, so as a special and in support of mental health awareness in this season, we are, usually it costs about 12 to 14 a unit in most places. We offer it at $9 a unit, but as a special we're doing, if you purchase 300 units, you get it at $7 a unit, which is a huge deal.
There you go.
We want people to try it out and just have a good time. So.
Well, excellent. We appreciate it very much. Oakview Medical Associates, 11 Five Forks Plaza Court in Simpsonville, the number 627-0444. Dr. Nita, thanks again, and have a great day. We appreciate it.
You're welcome. Thank you.
Now your